I'm Jennifer Smith.
And I'm Melva Jones.
And we are Women's Health in Black and White. And today we have a very special guest. We are pleased to introduce you to Candace Gates. She is a family nurse practitioner and has some expertise in infertility. Our last video was about fertility. We're going to talk about the flip side of that. And she has both personal and professional experience with this issue. So she's going to talk us through what the process of being diagnosed with infertility is like and what the next steps are so that you know going into it what's coming. Candace.
Yes, thank you for having me today. So I often get asked, how am I fertile, or am I having issues with infertility? And I explain to patients it can be very complex because there's a lot of different reasons as to why someone could be infertile. But the defining infertility is if you're less than 35, if you have been actively trying to conceive in a year considered infertile. And if you're over 35, then it's less if you've been trying for over 6 months. So they tend to decrease the time frame because of different factors that we're going to discuss. So of course there could be other risk factors too that could impact fertility that would prompt you to get checked out sooner. So that could be irregular cycles, which could be multiple issues hormonally usually, painful periods, worse than your peers, especially teenage painful cycles. If you've had a history of pelvic inflammatory disease, that can impact your fertility.
We talked about that when we talked about STDs.
Okay. And then also cervical procedures, having a leak procedure from abnormal pap smears and stuff like that. Those things can impact your fertility. So if any of those things have happened in the past or currently happening, then we want you to be seen earlier than that 1 year or 6 months.
Right.
Other causes of infertility, there's typically, you can break them down into 4 different topics, I guess you could say. One is irregular ovulation or anovulation, which means no ovulation. So basically that means that the egg's not being released monthly. Now some people say you either ovulate or you don't, and that's not always true. I mean, you can release an egg, but it can be more immature than a mature follicle and all that, and that can impact getting pregnant as well. Structural issues would be issues with the uterus or the tubes, and we're going to go into more detail soon. Ovarian reserve is also an issue, and that can actually happen at any age. Everybody thinks that just because you're young that you have infertility, and that's not always the case. Male factor is also the 4th issue that could potentially impact fertility.
It's not just a woman's problem.
Exactly. So it could be sperm counts low, hormonal issues, and certain things that I look for, talking to my patients is, is their spouse or significant other have problems with weight gain, problems with sleep apnea, history of thyroid issues, stuff like that, because that can cause them to have issues as well. So we don't always want to assume it's the woman that has the problem, So what do we do about checking for this stuff? So I typically will do a very thorough history to try to figure out what steps need to be taken next. Blood work is always going to be there. We're always going to need to check blood work. For ovulation, you want to check hormone levels. You want to check do an ultrasound mid-cycle to see, do you have a follicle there that you could potentially release an egg from? Check a progesterone level to see how well you ovulated. I tell my patients, the higher the better, because that means that the chances of, getting pregnant are better, and actually staying pregnant are better too, because typically if you have a lower progesterone level, that does increase your risk for early miscarriages too. So a good number is, I usually like it greater than 10 progesterone level on cycle day 21. So structurally, we want to check your tubes to make sure they are open so that the egg can meet the sperm and then fertilize and then implant in the uterus. So, if there's a blockage anywhere, that's not going to happen. So, we want to check those things. Also, another structural thing to check is a hysteroscopy, and that's where we actually look inside the uterus with a camera, put some saline in there, and check for polyps, or check for scar tissue. we've had patients that have had DNCs in the past for miscarriages, and that can leave scar tissue, can make it harder to get pregnant as well. So those things are important to look at. Also, just ultrasounds in general as well. You want to check to see if there's fibroids there. Is there ovarian cyst? Checking for PCOS and those kind of things too. So you want to look at doing an ultrasound. Ovarian reserve is something that is super important, and we have a lot of people who are waiting until they're older to have babies, but
Sure.
because of school or whatever, their career. And so a couple of things we want to look at is, of course, family history. That's super important because did your mom have issues getting pregnant? How old was she when she went through menopause and things like that? So we want to check an egg count with an AMH level, anti-Müllerian hormone. It's a hormone that you can check preferably at the beginning of your cycle, but it doesn't have to be. But basically it checks the hormones around all the eggs and the ovaries.
Just to review, the beginning of your cycle is day 1 when your period starts.
Right.
So a lot of people that think of that as the end of the cycle, but we call that the beginning.
Correct. And another thing to check for ovarian reserve is cycle day 3 ovarian function. So you want to check FSH and LH, and then the estrogen levels. And that's also going to tell you a lot as well, because it's very complex. It is a very complex thing because you can look at those hormones and tell a lot as far as if someone is super stressed, their function is going to be suppressed down. So
we were talking about this in the office yesterday. The mind-body relationship is extremely strong, and our infertility patients that come in so hyped up and stressed and they're so deeply entrenched in getting pregnant that the first thing you have to do is say, calm down.
Yes, absolutely. I've said that many times.
Take it down.
I've been there, I know.
And I think that's like one of the things people don't really consider, but they're so worried about, is this ovulation day? What is my temperature? I need to have sex right now. I don't need to have sex. And all that, it does play a big part on your stress levels and you getting pregnant. A lot of times when people are like, okay, I'm done with it, I'm taking a break, that's when a lot of them pop up pregnant.
Absolutely. But I know that the patients get frustrated when people say, just relax, and get pregnant. And I try to explain it, as it's not a just relax thing, it's a lot goes into it, and there's a reason why relaxing actually will help. And so then you talk about just, ways to do that, and that's different for everyone. So,
very much so.
Figuring that out too. So, yeah, it's a huge thing. So checking ovarian function is really important. It can tell you a lot. Male factor, there's a few different things you want to check. A semen analysis, if you get one good one, that's usually a good sign. But typically if the first one comes back abnormal, you do want to repeat it because it takes about 70 days or so for the sperm to actually mature. And also another thing that a lot of people don't realize is that things that happened 2 or 3 months ago, like say they had flu or whatever, anything that can impact your immune system, that can actually impact your sperm production as well. So if you have an abnormal sperm count one time, that doesn't necessarily mean that that's always and forever going to be that way.
Would you recommend starting with a semen analysis before you do this big workup on the woman?
Well, it depends. A lot of times I do, like if they've fathered a child before or gotten someone pregnant before, I typically don't start there, but a lot of times what I'll do is just do basic hormones on the female, and if I'm just not getting what I think is there, then a lot of times I'm like, okay, let's go ahead, because it's easy to rule out the male. So then at that point, then I would definitely do that. So it's kind of, it's a very complex assessment that I do to try to figure out what needs to be done next, but that just comes from experience working with that. So, but a lot of times it is very easy, but a lot of times I find that the guys are just not wanting to do that. So they're just like, I don't want to do it because they're scared that it's going to hurt their manhood or whatever. So, it's one of the things that they're kind of hesitant sometimes.
A lot of pride.
It is.
I was just about to say, they don't want to feel like they're the ones that can't get it done. But.
And then when they get the report that everything's great, then they're super excited about that. But, then the poor female is like, okay.
Great, so it's me.
Yeah, absolutely. So then we're crying about that too. So I'm like, it's okay. So those are the ways that we would kind of check those different areas. Other things that are also important in talking with someone trying to get pregnant, and that could be for just someone just coming into the office saying, what do I need to do? How do I start? We're thinking about it in the next year. What do we need to do to kind of get there? And so past medical history is super important. You want to look at, do they have a history of high blood pressure, diabetes, thyroid issues, any history of clotting disorders? Those things are important too. Environmental issues, are they exposed to chemicals? In the males, for sure, a lot of pilots have a lot of issues with fertility too because they're exposed to a lot of
high temperatures.
Yeah, high temperatures and stuff like that, and then it can impact their sperm. Stress, as we mentioned, stress is huge. Stress for sure, and that can be just normal everyday stress. That can be excessive exercise. For long, and especially. We have a lot of younger athletes and stuff, like when they were teenagers, they don't have periods. And it's because they're just go all the time, and it just suppresses ovarian function. So, and they're super sensitive, and then that high energy exercise all the time, they carry on until their 20s and 30s, and they just keep doing it, and it just impacts fertility that way because their stress levels have been high for so long. So stress is super important. Nutrition is huge. Nutrition is a big component of preconception care, and that carries on over into pregnancy and postpartum, and then just your whole life basically. So a lot of things related to like prediabetes, insulin resistance, PCOS, those kind of things. Also, eating disorders, those are things that are important as well to identify, and it's sometimes a hard question to ask, but it can impact fertility a lot of times as well. So nutrition is always important. Especially with insulin resistance and PCOS, it does increase the risk of early miscarriages and gestational diabetes and gestational hypertension, and then also later on down the road diabetes as well. So,
and Candace is going to cover PCOS for us in detail in a future video, so stay tuned.
And then also social issues, like alcohol abuse, tobacco use, drug use, and stuff like that. Those are always things important to talk about as well. Genetics is a really important thing. Carrier screenings prior to getting pregnant. That way going in, hey, I'm a carrier for this.
Right.
But then, you can, if you test positive for something, if you are a carrier for something, then your significant other can get checked as well. And then that way do you have, is there a chance that your baby could be born with it? So
we're talking about genetic diseases like cystic fibrosis, spinal muscular atrophy, Duchenne's muscular dystrophy. Did I say that right? Muscular dystrophy.
Yep.
Sometimes words are hard.
Sickle
cell anemia is a big one, and it's not just the Black community. We think of CF as a white disease and sickle cell as a Black disease, and that's true for the majority of the patients, but not for everybody. I've had Black CF patients. I've had white sickle cell patients. So I think it's important to test everyone across the board. These are things that if one of the parents carries it and the other one doesn't, we don't have a problem.
Right.
But if they both carry it, we have the potential to pass that disease on to a baby, and it is something we can test for, so it's a good thing to do and be prepared.
Right. Yep, exactly. So the different causes of infertility, how do we manage that? How do we treat it? So not ovulating, of course, you want to improve ovulation. We want you to ovulate. So I get super excited when someone has a spontaneous natural period because that means they ovulated. So that's super important. So I get
and I get depressed. Candace is excited.
I get really excited about it. So, so that just means that the process is working. Their hormones are getting in balance and all that. So we want to improve ovulation. Diet changes across the board. Anyone who's trying to get pregnant, I always recommend doing a lower carb diet. It makes a huge difference in ovulation. It corrects those imbalances in testosterone and estrogen and progesterone. So it's super important.
And insulin resistance.
Yes, absolutely. And even if you don't have a problem with insulin resistance or PCOS, keto and low carb works great. As I am.
And she does very well.
Yeah. It does work, even if you don't have problems with that. Also, decreasing your stressors is huge. Whatever those stressors are, just finding ways to lower that. Yoga's great, walking's great, cutting out the high intensity exercises. And I know it's hard because I've been there. I know it's really hard, but it really makes a huge difference. And then you come to learn to love new things. Like I've learned to love yoga. It's really great for that.
Right.
Especially
exercise is good. We're not saying it's bad.
Right.
We're just saying to explore alternate exercises.
Yes. And you don't have to have your heart rate elevated all the time, for extended periods of time because that will negatively impact your hormones. So, cause you to not ovulate well. But also there's other ways. I mean, meditation, prayer, reading, whatever you enjoy doing. It could be painting, taking pictures, whatever lowers your stress level. Those are the things that I always recommend doing. So just whatever that looks like.
And those are the things that you should do before you ask for medication for anxiety.
Absolutely.
Oh God,
Absolutely.
yes.
Absolutely. And it's, I hear it every day. It's so,
but my God, try something first before medication.
Absolutely.
Because the medication is not gonna cure everything.
Right.
And I don't think people get that piece of it. They just want, I just need this med, but you still have to do other self-care things.
Right. Well, the same with weight loss. The same thing.
Absolutely.
Mm-hmm.
Don't come to me for a diet pill because that's not going to happen.
Right.
So.
And those anxiety medications that you might feel like you need or want, you can't have them in pregnancy.
Right.
Mm-hmm.
So if you successfully control your anxiety and get pregnant, the first thing I'm going to do is take you off all of that.
Yeah, absolutely. Structural issues, typically we're going to go in and do surgery. If there's something going on with the tubes, we need to try to open them up. If there's fibroids that could potentially be impacting implantation of a baby, we need to go in and take those out. Also, polyps are huge. They can really impact implantation as well because they're usually inside the cavity of the uterus. So surgery is is the main way that we take care of that. Ovarian reserve, it's hard because you can't put eggs back in the ovaries. Once they're gone, and that's a hard pill to swallow for even me having to tell patients that. Unfortunately, I've had to tell patients that in their early 20s before, and it's really hard. It's very hard because they're ready to have a baby, and so there's not a lot that you can do. There's nothing you can do for ovarian reserve. The best course that you can do is refer to a specialist, to reproductive endocrinology, and then what I tell patients is based on what I'm seeing with their AMH level is, okay, you might can do injections, but if it's really bad, if it's pretty significant, I'm like, okay, IVF or donor egg. It's really the only options. And to get there as soon as you want to get there is like try to just go ahead and start that process. There's no point in trying to do letrozole or just trying to do small little mini stimulation cycles or anything with injections, because it's just like you just need to try to get as many as possible. Because if you have a low ovarian reserve when you're younger, especially, then chances are the quality of those eggs are pretty low too. So because there's something going on. One of the things I see is endometriosis. Endometriosis definitely impacts ovarian quality and ovarian reserve, because it just causes a lot of inflammation in the cavity and just ages those eggs. So it's really, ovarian reserve is the hard one. It really is.
There's just no way to fix it.
Yeah, absolutely. Male factor, typically if there's something going on with the semen analysis or hormonal issues or something, I refer to either the reproductive endocrinologist or urology. It just kind of depends on what area where you live. Also, other things that I tell my female patients, if there is an issue, I recommend weight loss for the guys too, because insulin resistance and diabetes, prediabetes, that can impact the sperm count too. Because with men, their primary hormone is testosterone, but when they have those other metabolic issues going on, what will typically happen is their testosterone is more suppressed and their estradiol level is higher, and so that impacts the sperm quality. So if you can get some weight off and do the diet and just get those things regulated, a lot of times that will help. So
none of this exists in a vacuum. All of your hormones affect each other.
Right. Absolutely. So those are the main ways that we treat those things. And I think that is about all I have on infertility as far as how we manage it and all that.
I think the take-home message is, if you are looking to be pregnant, if you want a baby, and you are under 35, give it about a year.
Right.
I wouldn't give it much more than that. And I would definitely make a preconception appointment with your physician. Go in and talk through it. Even before you're ready to start infertility treatment, try to get your health the best it can be. Discuss these issues like preconception testing, carrier testing. Get your health where it needs to be. Hopefully that's all you'll have to do. If you hit that year mark and you wind up not where you want to be, then we can get a lot more aggressive with the next step. But the most important thing that you can do to be a healthy parent, mother or father, is to maximize your health.
Right.
And then, of course, if you are over 35, your time is limited. Please don't wait. Please don't just sort of hope for the best.
Mm-hmm.
Please be much more aggressive about getting treatment and testing as soon as possible, because once we hit 35, our bodies change drastically and quickly, and it becomes much more unlikely that you'll conceive. I want you to wind up with the family that you want. So come and see us as soon as you can. That's all for today. Please go visit our Facebook page and find us on Twitter
and Instagram.
We
have a podcast.
We do. We're actually going to add to it someday, I promise.
Right.
We have some videos coming up that were special requests. So in the future, we're going to have a video about recurrent yeast infections and human papillomavirus and the vaccine. Those are coming via special request really soon.
Right.
And
one for BV too, right?
And one for BV2, yep. And very soon I'm going to have a back to school special for you college girls. So stay tuned, and we wish you the best health.